Black girl stepped forward. Hospital went silent. She cannot possibly know what she is talking about. Dr. Harrison Cross speaks these words in the packed surgical consultation room of Massachusetts General Hospital, his voice carrying the certainty of a man who has never been questioned in his 37-year career. The 17-year-old black girl standing near the back wall in faded jeans and a hoodie she has owned since 8th grade does not flinch. She does not shrink. Her name is Amara Okonkwo, and she has been waiting for this moment for 4 years, 7 months, and 13 days. The room contains 11 of the most accomplished cardiovascular surgeons in the northeastern United States, men and women who have collectively performed over 22,000 open-heart procedures, and every single one of them has just declared what she knows to be a lie. They have declared the surgery impossible. They have declared that Benjamin Holloway, the 73-year-old former Secretary of Health and Human Services lying in the ICU 17 floors above them, will die within the week because no surgical intervention can save him. Amara knows they are wrong. She knows because her father taught her the procedure that could save this man's life before he died on a bathroom floor in their 2-bedroom apartment in Roxbury, his own heart stopping, while the hospital that had fired him for being too aggressive with experimental techniques refused to see him as anything other than a liability. Dr. Cross looks at her the way people have looked at her for her entire life. He sees the braids, he sees the melanin, he sees the youth and the poverty stitched into the fabric of clothes that have been washed too many times. He does not see the daughter of the most brilliant cardiac surgeon who never received the recognition he deserved. He does not see the girl who has spent every night since she was 13 studying her father's journals, his diagrams, his revolutionary approach to a procedure that the medical establishment dismissed because it came from a black man working in a community hospital instead of a white man at a prestigious institution. Dr. Cross sees nothing, and that is exactly why Amara Okonkwo is about to make him see everything. 23 hours earlier, Amara sits in the waiting area of the cardiovascular surgery department, a manila folder clutched against her chest. Inside that folder are 47 pages of her father's handwritten notes, diagrams that map a surgical approach to tricuspid valve reconstruction, combined with right ventricular assist device implantation that no one in the official medical literature has ever documented. Her father called it the Okonkwo procedure, though he knew no one would ever name it after him. Chibuzo Okonkwo came to the United States from Nigeria at age 19, with a scholarship to Johns Hopkins and a dream of becoming the kind of doctor who could save the lives that poverty had taken from his own family. He graduated at the top of his class. He completed his residency with distinction. And then he watched as every prestigious cardiothoracic fellowship went to candidates who looked nothing like him, whose research was derivative of work he had already completed, whose last names did not require pronunciation guides. He ended up at Boston City Hospital, where the patients were poor and the resources were limited, and the administration cared more about cost efficiency than surgical innovation. He thrived anyway. For 18 years, Chibuzo Okonkwo performed surgeries that should have been impossible. He developed techniques that extended life expectancies. He wrote papers that were rejected from journals whose editors never bothered to read past his biographical information, and every night, he came home to the daughter who had become his only student, the girl who sat beside him at the kitchen table while he explained the architecture of the human heart as if it were a cathedral whose secrets only they understood. Amara was 9 years old when she performed her first suture on a chicken breast under her father's supervision. She was 11 when she could identify every structure of the heart from memory. She was 13 when her father began teaching her the procedure that would become his legacy, the surgical approach he had developed over 15 years of quiet innovation, the technique that could save patients whom everyone else had given up on. She was 13 years and 47 days old when she came home from school and found her father lying on the bathroom floor, his hand pressed against his chest, his eyes already beginning to dim. The ambulance took 19 minutes to arrive. Too long. Everything after that is too long. The hospital where he had worked for nearly 2 decades sent flowers to his funeral. They did not send a representative. They did not acknowledge that the man they had employed was anything more than a competent surgeon who had worked himself into an early grave. They did not know that everything Chibuzo Okonkwo had learned, everything he had discovered, everything he had dreamed of achieving, was already living inside his daughter. Amara stands in the waiting area now because 3 days ago, she saw Benjamin Holloway's face on the news. Former HHS secretary in critical condition, the headline read, "Rare heart defect leaves doctors scrambling." She watched the medical correspondent explain the situation in terms the public could understand. A congenital abnormality in the tricuspid valve, undetected for 7 decades, now causing catastrophic right heart failure. Multiple surgical teams consulted. No viable intervention identified. The patient is expected to die within 10 days without surgical correction. Amara recognized the condition immediately. She had seen diagrams of it in her father's journals. She had listened to him describe in patient detail how the standard approaches would fail. The valve leaflets were malpositioned. The right ventricle was compromised. The typical reconstruction techniques would not work because the underlying anatomy was too abnormal for conventional methods. But her father had solved this problem. 7 years before his death, he had treated a patient with a nearly identical presentation. A 44-year-old woman named Denise Carter, a bus driver from Dorchester with no insurance and no options. Every other surgeon had turned her away. Chibuzo Okonkwo had spent 3 months developing a modified surgical approach, a technique that combined elements of cone reconstruction with a revolutionary method of right ventricular support that bypassed the traditional limitations. Denise Carter survived. Denise Carter. She is still alive today, driving the 28 bus route through Mattapan, her heart beating with the strength of a woman half her age. No one knows what Chibuzo Okonkwo did for her. No one published a paper. No one gave a conference presentation. But Amara knows. And now Amara sits in this waiting area, holding the documentation that could save Benjamin Holloway's life, waiting for someone to listen to a 17-year-old black girl from Roxbury who has no medical credentials and no institutional backing, and nothing except 47 pages of genius that the world refused to recognize. The receptionist looks at her with polite confusion. "Can I help you?" Amara approaches the desk. "I need to speak to someone about Benjamin Holloway's case. I have information that could help." The receptionist's expression does not change, but something behind her eyes does. It hardens, becomes protective of the institution she serves. "Are you family?" "No. I am the daughter of Dr. Chibuzo Okonkwo. He developed a surgical technique that could save Mr. Holloway's life." The receptionist types something into her computer. She reads the screen. She looks back at Amara. "I am not showing any Dr. Okonkwo affiliated with this hospital. He was not affiliated with this hospital. He worked at Boston City. He passed away 4 years ago. But his research contains the answer. I have documentation of the procedure." The receptionist picks up her phone. She speaks quietly into the receiver. After a moment, she hangs up. "Someone will be with you shortly. Please have a seat." Amara sits. She waits. She thinks about her father teaching her to tie surgical knots using fishing line and a towel rack in their bathroom. She thinks about his hands, the steadiest hands she has ever seen, demonstrating the precise angles of approach for the modified cone technique. She thinks about the way he would look at her after she mastered a new skill, the pride in his eyes that no one else in the world could give her. An hour passes, then 2. Other people come and go. Doctors in white coats, administrators in suits, family members with haunted expressions. Everyone moves around Amara as if she is invisible, as if she does not exist, as if her presence in this space is an aberration that the institution's immune system will eventually correct. After 3 hours and 17 minutes, a young man in green scrubs approaches her. He is maybe 30, with tired eyes and the energy of someone who has not slept enough in years. His badge says his name is Dr. Kevin Park. He is a 4th-year cardiothoracic surgery resident. "You are the one asking about the Holloway case?" Amara stands. "Yes, I have information about a surgical approach that could work." Dr. Park looks at the folder in her hands. He does not reach for it. "May I ask what your qualifications are?" "I do not have any official qualifications. My father was Dr. Chibuzo Okonkwo. He was a cardiac surgeon at Boston City Hospital. He developed a technique that could address the specific anatomical challenges in Mr. Holloway's case." Dr. Park's expression flickers. Something like interest, quickly suppressed. "Look, I appreciate that you want to help, but this is a highly complex case being managed by some of the best surgeons in the country. We cannot just take surgical recommendations from someone without medical training. I understand how it looks. But my father performed this exact procedure on a patient with nearly identical pathology. Denise Carter, August 2017. I have his operative notes. I have his diagrams. I have everything you would need to replicate what he did." Dr. Park hesitates. For a moment, Amara thinks he might actually listen. Then his pager buzzes. He glances at it. His expression closes. "I am sorry. I really am. But I have to get back to work. If you want to leave your contact information at the desk, someone might follow up." He is gone before she can respond. Amara sits back down. She opens the folder. She looks at her father's handwriting, the precise letters and carefully drawn diagrams that contain the answer to a problem that is killing a man 17 floors above her head. She thinks about leaving. She thinks about going home to the apartment where her mother works double shifts to keep the lights on, where her younger brother is struggling through 8th grade without the father who used to help him with his math homework, where the weight of loss hangs in every room like humidity that will not break. She thinks about how easy it would be to give up, to accept that the world does not listen to people like her. To let Benjamin Holloway die because the people who could save him are too arrogant to accept help from the wrong kind of person. But then she thinks about her father's voice, the quiet determination that never wavered even when the world told him he was not enough. She thinks about Denise Carter still driving her bus, still alive because one man refused to accept the word impossible. She is not leaving. She is going to make them listen. 12 hours later, Amara stands in the surgical consultation room where 11 of the most accomplished cardiovascular surgeons in the northeastern United States have just declared Benjamin Holloway's case hopeless. She has spent the night in the hospital. She has slept in a chair in the waiting area. She has eaten a vending machine sandwich and drunk 3 cups of coffee that tasted like battery acid. She has watched doctors come and go, their faces growing more grim as the hours pass. She has listened to the news reports updating Holloway's condition, deteriorating, critical, time running out. And when she heard that the surgical team was meeting at 8 a.m. to discuss their options, she followed them. She walked through doors she was not supposed to enter. She ignored the questioning looks from nurses and technicians. She found the consultation room and slipped inside before anyone could stop her. Now, Dr. Harrison Cross is staring at her with the kind of contempt that wealthy, powerful men reserve for those they consider beneath notice. Security has been called. 2 officers are making their way through the hospital corridors. In approximately 3 minutes, Amara will be escorted out of the building and probably banned from the premises. She has 3 minutes to change the course of a dying man's fate. "You need to leave," Dr. Cross says. "This is a private medical consultation. You have no right to be here." "I have information that could save your patient," Amara says. Her voice does not waver. "If you would just look at these documents for 5 minutes, you would see that there is an alternative approach." One of the other surgeons, a woman in her 50s with silver hair and tired eyes, speaks up. "Let security handle this, Harrison. We have work to do." Amara steps forward. "The woman you're about to dismiss saved a life with a technique none of you have ever seen. Denise Carter, 44 years old, presented in 2017 with congenital tricuspid valve abnormality and severe right heart failure. Same pathology as your patient. My father operated on her. She survived. She is still alive." The room goes quiet. Dr. Cross looks at the other surgeons. "This is absurd. We are not going to take medical advice from a child who broke into our consultation room." Amara opens the folder. She pulls out the first diagram, a detailed illustration of the modified cone reconstruction technique her father developed. This is the approach. It addresses the malpositioning of the valve leaflets by creating a new attachment point on the posterior annulus. Instead of trying to reshape the existing tissue, you construct a neo-valve using the patient's own pericardium, reinforced with a biologic scaffold. The right ventricular dysfunction is managed simultaneously through a modified RVAD implantation that does not require complete arrest. Dr. Cross's expression changes. Something flickers behind his eyes. Confusion, interest, denial. "Where did you get this?" "My father developed it. Dr. Chibuzo Okonkwo. He worked at Boston City Hospital. He died 4 years ago. This is his research." Dr. Park, who is standing near the back of the room, speaks up. "I talked to her yesterday. I told her we could not accept outside recommendations. She does not have any medical training." Amara looks at him. "Training is not the same as knowledge. I have studied cardiac surgery for 9 years. I have read every paper, every textbook, every journal article. I have practiced surgical techniques until my hands can perform them in my sleep. I do not have a degree, but I have something none of you have. I have the solution to your problem." The door opens. 2 security officers enter. Dr. Cross nods toward Amara. "Please escort this young woman out of the building." "Sir," the first officer says, "we will need to document this for our report. Is she a patient, a visitor, or something else?" "She is a trespasser," Dr. Cross says. "She has no business being here." Amara feels the officers approaching. She has seconds left. She speaks quickly, loudly to the room. "Denise Carter, Massachusetts General can verify her surgical history. Call Boston City Hospital and ask about the procedure performed in August 2017. Check the outcomes, check the survival, and then ask yourself why you are so determined to ignore evidence that could save a man's life. The officers take her arms. They are not rough, but they are firm. Amara does not resist. She has said what she needed to say. She has planted the seed. As she is led toward the door, Dr. Cross's voice follows her. Get her out of here, and make sure she does not come back. Amara is escorted through the hospital corridors, past the nurses and patients and visitors who watch with curiosity and confusion. She is taken to an office near the main entrance where her information is documented, and she is formally banned from Massachusetts General Hospital property. The security officer who processes her paperwork is a black man in his 50s with a name tag that reads Officer Williams. He looks at her with something that might be understanding. What were you doing up there? Amara tells him. She explains about her father, about the procedure, about Denise Carter and the surgery that saved her life. She explains that Benjamin Holloway is going to die because the doctors who could save him refused to listen to a 17-year-old black girl from Roxbury. Officer Williams listens. When she finishes, he is quiet for a long moment. Your father sounds like he was a good man. He was the best, Amara says. He taught me everything he knew, and nobody will listen. Officer Williams slides a piece of paper across the desk. This is your formal notice of trespass. If you return to this hospital, you will be arrested. Amara takes the paper. She folds it carefully. She puts it in her pocket. Then she stands and walks out of the hospital into the cold October morning, where the sky is gray and the wind smells like rain. And somewhere above her, a man is dying because the world has decided that expertise wrapped in the wrong skin is worthless. She walks to the bus stop. She waits. She rides home. She tells her mother what happened. Her mother, Grace Okonkwo, a woman who has survived more disappointment than any human being should have to endure, holds her daughter and says nothing for a long time. Then she says, "Your father would be proud of you." Amara does not cry. She does not break. She goes to her room and opens her father's journals and begins reading again from the beginning, because she knows that this is not over. Somewhere in these pages is the key to making the world listen. 47 hours after Amara's removal from Massachusetts General Hospital, Benjamin Holloway's condition deteriorates dramatically. His right ventricular function drops to 18%. His oxygen saturation falls below 85, even with maximum support. The surgical team reconvenes for an emergency consultation. They discuss experimental interventions. They discuss palliative care. They discuss the inevitability of death. Dr. Harrison Cross sits at the head of the table, his face drawn, his hands clasped in front of him. He has performed over 4,000 cardiac surgeries in his career. He has saved lives that should have been lost. He has built a reputation as one of the foremost cardiovascular surgeons in the country. And now he is preparing to tell Benjamin Holloway's family that there is nothing more he can do. The other surgeons file out of the room. Cross remains. He stares at the conference table, at the files spread across its surface, at the imaging studies that show a heart too damaged to repair. He thinks about the girl, the teenager with the folder full of handwritten notes, the daughter of a doctor he has never heard of, claiming to have access to techniques that could save his patient. He thinks about how ridiculous it was, how presumptuous, how impossible. But he also thinks about the name she mentioned, Denise Carter. He pulls out his phone. He makes a call to the records department at Boston City Hospital. He asks them to search for a patient named Denise Carter, who underwent cardiac surgery in August 2017. The records clerk tells him he will need to submit a formal request. Cross identifies himself. He explains that he is the attending surgeon on a critical case and needs urgent verification. The clerk hesitates, then agrees to expedite the search. 14 minutes later, Cross's phone rings. The clerk has found the file. Denise Carter, 44 years old at time of surgery. Congenital tricuspid valve abnormality with severe right heart failure. Operated on by Dr. Chibuzo Okonkwo on August 23, 2017. The procedure is documented as a modified cone reconstruction with simultaneous right ventricular support device implantation. Post-operative recovery was uncomplicated. Patient was discharged after 12 days. Follow-up records indicate continued cardiac function within normal parameters. Most recent echocardiogram was performed 8 months ago. Results were excellent. Cross ends the call. He sits in the empty conference room. He stares at the wall. He thinks about everything he has believed about who deserves to be heard and who does not. He thinks about the certainty with which he dismissed that girl. He thinks about how many times in his career he has made similar judgments, based on similar assumptions, without ever stopping to question whether he might be wrong. He picks up his phone again. He calls Dr. Park. "Find that girl," he says. "The one from yesterday. Find her and bring her back." Park's voice is confused. "Sir? The one you had removed from the hospital. The one with the folder. Find her. Bring her here. Now." There is a pause. "Sir, I do not even know her name. Her father's name was Okonkwo," Cross says. "Dr. Chibuzo Okonkwo, Boston City Hospital. He died 4 years ago. Find her." Park hesitates. "And if she does not want to come, tell her we are ready to listen." The silence on the line stretches. Then Park says, "I will find her." Cross ends the call. He looks at the files in front of him. He looks at the imaging studies showing Benjamin Holloway's failing heart. And for the first time in more than 3 decades of medical practice, Dr. Harrison Cross confronts the possibility that he has been wrong about something fundamental. Not just about this case, not just about this girl, about everything. 4 hours and 37 minutes later, Amara Okonkwo walks through the doors of Massachusetts General Hospital for the second time. She is accompanied by Dr. Kevin Park, who found her at her apartment in Roxbury and delivered Dr. Cross's message with an expression of genuine bewilderment. She is also accompanied by her mother, who refused to let her daughter return to the hospital that had thrown her out without protection. Grace Okonkwo walks beside her daughter with the quiet strength of a woman who has spent her entire life being underestimated and has learned to carry that weight without bending. The manila folder is still in Amara's hands, the 47 pages of her father's notes, the diagrams, the operative reports, the legacy of a brilliant man who never received the recognition he deserved. They are led to a conference room on the 9th floor. Inside, Dr. Cross waits alone. He stands when they enter. His face is unreadable. "Miss Okonkwo," he says, "please sit down." Amara sits. Her mother sits beside her. Park hovers near the door, uncertain whether he should stay or go. Cross looks at Grace Okonkwo. "You are her mother?" Grace nods. "I am, and I want to be clear about something before we proceed. My daughter came to you with information that could save a man's life. You had her thrown out like she was nothing. If you have called her back here to humiliate her again, we will leave right now, and you can explain to Benjamin Holloway's family why their loved one died because of your pride." Cross nods slowly. "I understand, and I owe your daughter an apology." He turns to Amara. "I verified the case you mentioned. Denise Carter. I spoke to the records department at Boston City. The surgery your father performed was extraordinary. The outcomes were remarkable, and I dismissed you without even looking at the evidence you brought. I was wrong." Amara does not respond. She waits. "I need your help," Cross continues. "Benjamin Holloway has less than 48 hours. Every approach we have considered has failed. If your father's technique is as effective as the Carter case suggests, it may be his only chance. I'm asking you to show us what you know." Amara opens the folder. She lays the pages on the conference table. She begins to explain. She talks about the anatomical challenges of the case. She describes the way the standard cone reconstruction fails when the valve leaflets are severely malpositioning. She explains her father's innovation, the creation of a neovalve using autologous pericardium reinforced with a bioscaffold matrix. She describes the modified RVAD implantation technique that allows simultaneous ventricular support without requiring full cardiac arrest. She talks for 47 minutes. She draws diagrams on a whiteboard. She answers questions with precision and clarity. She demonstrates knowledge that would be remarkable in a surgical resident with years of training, let alone a 17-year-old high school student. When she finishes, Cross is silent for a long moment. Then he speaks. "I have never seen anything like this." Amara looks at him. "My father spent 18 years developing this approach. He saved lives that everyone else had given up on. And the only reason you have never seen it is because no one would listen to him either." The words hang in the air. Cross does not look away. He does not make excuses. He simply nods. "You are right. And I am sorry. For what happened to your father. For what happened to you. For all of it." Grace Okonkwo speaks. "Sorry is not enough." Amara looks at her mother, then back at Cross. "My mother is right. An apology does not undo what happened to my father. It does not undo the years of rejection and dismissal. It does not bring him back. But you can do something that matters. You can save Benjamin Holloway's life, and you can make sure the world knows who made it possible." Cross nods. "What do you want?" Amara speaks carefully. "I want my father's name on the procedure, the Okonkwo technique. I want his contribution acknowledged in any publications, any presentations, any documentation. I want the medical community to know that this innovation came from a black surgeon at a community hospital who was never given the chance he deserved. And I want to be in the operating room when you perform the surgery. The last request makes Cross pause. That is not possible. You are not a medical professional. There are liability issues, credentialing requirements. Amara does not back down. I am not asking to operate. I am asking to observe, to be present when my father's work saves a life. You can find a way to make that happen if you want to. Cross looks at Park, who shrugs slightly. It would be unusual, but not impossible. If she were credentialed as a technical consultant or observer, there might be a pathway. Cross turns back to Amara. If I agree to your terms, will you help us prepare for the surgery? Amara nods. Every step of the way. The surgery is scheduled for 6 a.m. the following morning. The next 12 hours become a blur of preparation. Amara works with the surgical team to review her father's notes in detail. She explains the specific instruments required, the positioning, the sequence of steps that must be followed precisely. She answers questions from surgeons who are decades older than her, who have performed procedures she has only studied on paper, who are now relying on her knowledge to guide them through territory none of them have explored. Dr. Park stays by her side throughout the night. He brings her coffee. He asks questions that show genuine curiosity rather than condescension. At one point, during a brief break, he sits down next to her in the empty cafeteria. Can I ask you something? Amara nods. How did you learn all this? I mean, really learn it. Not just memorizing it from a book, but understanding it the way you do. Amara is quiet for a moment. My father started teaching me when I was 9 years old. Every night after dinner, we would sit at the kitchen table, and he would explain how the heart works. Not just the mechanics, but the philosophy. He used to say that surgery is not about cutting and stitching. It is about understanding the story the body is trying to tell and writing a better ending. Park considers this. He sounds like an incredible teacher. He was. Amara pauses, and he was also invisible. The most brilliant man I have ever known, and the system treated him like he did not matter. Do you know how many papers he tried to publish? 17. Do you know how many were accepted? 0. Not because the work was not good enough, because the reviewers did not take him seriously. Park does not say anything. There is nothing to say. The truth is too heavy for words. At 5:47 a.m., Amara is escorted into the operating room at Massachusetts General Hospital. She is wearing sterile scrubs and a surgical cap. She has been credentialed as a technical consultant, a designation that allows her to be present without violating hospital protocols. Grace Okonkwo waits in the family area, her hands clasped together, her eyes fixed on the clock. Benjamin Holloway lies on the operating table, his chest already opened, the mechanical support systems keeping him alive, while the surgical team prepares for the most complex procedure any of them have ever attempted. Dr. Cross stands at the table, his hands steady, his eyes focused. Behind him, a team of 6 nurses and 3 additional surgeons wait for his direction. The monitors beep. The ventilator hisses. The room smells of antiseptic and electricity. Cross looks at Amara. She's standing near the head of the table, where she can see the surgical field without interfering with the team's movements. You understand the procedure better than anyone in this room, Cross says. If you see something wrong, speak up. I do not care about protocol. I care about keeping this man alive. Amara nods. She does not speak. She watches. The surgery begins at 6:02 a.m. For the next 9 hours and 14 minutes, Amara Okonkwo watches her father's legacy save a man's life. She speaks 3 times during the procedure, once to correct the angle of approach for the neovalve construction, once to remind the team about the specific tensioning required for the pericardial sutures, once during a moment of crisis when the RVAD implantation causes unexpected bleeding to suggest a modification to the cannulation technique that her father had documented in his notes. Each time she speaks, the room falls silent. Each time, Dr. Cross listens. Each time, her guidance proves correct. At 3:16 p.m., the surgery is complete. Benjamin Holloway's heart beats on its own. His vital signs stabilize. The team steps back from the table, exhausted but triumphant. Cross looks at Amara. His eyes are wet. Thank you, he says. Amara looks at the man on the table. The man whose heart now carries the fingerprints of a surgeon who died alone on a bathroom floor in Roxbury, unrecognized and unmourned by the profession he had served. Thank my father, she says. The news breaks within hours. Former HHS secretary survives unprecedented cardiac surgery. The story spreads across every major network, every newspaper, every online platform. Reporters gather outside Massachusetts General. They interview Dr. Cross, who stands at a podium and does something he has never done in his entire career. He gives credit to someone else. The procedure performed today was developed by Dr. Chibuzo Okonkwo, Cross says, a brilliant cardiac surgeon who worked at Boston City Hospital until his death 4 years ago. His innovative techniques were never published, never recognized by the medical establishment. We only learned of them because his daughter, Amara Okonkwo, refused to give up when we told her no. Without her persistence, without her knowledge, Benjamin Holloway would not be alive right now. The cameras turn to find Amara. She is standing at the edge of the crowd, her mother beside her, wearing the same faded jeans and hoodie she wore when she first walked into this hospital 2 days ago. Reporters shout questions. Miss Okonkwo, how does it feel to have saved a life? Miss Okonkwo, what do you want people to know about your father? Miss Okonkwo, what are your plans for the future? Amara approaches the microphone. She speaks quietly, but her voice carries. My father dedicated his life to saving people who had no one else to help them. He was denied recognition. He was denied resources. He was denied the respect he deserved because of how he looked and where he worked. But he never stopped trying. He taught me everything he knew because he believed that knowledge should not die with the person who discovers it. He believed that every life is worth saving. Today, his belief was proven right. She pauses. The crowd is silent. I want people to understand that what happened to my father was not an accident. It was a system that decides who gets to be heard and who gets to be ignored. A system that values credentials over competence and connections over capability. Benjamin Holloway almost died because of that system. The doctors who could have saved him dismissed the evidence because it came from the wrong person. How many other patients have died because brilliant doctors like my father were never given a chance? How many lives have been lost because we refuse to listen to people who do not look like what we expect? Amara looks directly into the cameras. My father is not here to see this moment. He died believing that his work would never matter. But I am here, and I am going to make sure that what happened to him never happens to anyone else again. In the weeks that follow, the story of Amara Okonkwo and the Okonkwo technique becomes a national conversation. Medical journals that rejected Chibuzo Okonkwo's papers during his lifetime now scramble to publish retrospective analyses of his work. The American Heart Association issues a statement acknowledging the contribution of innovative surgeons from underrepresented backgrounds. Massachusetts General Hospital establishes a fellowship program in his name designed to support cardiac surgeons from community hospitals who are developing novel techniques. Harvard Medical School offers Amara a full scholarship, beginning whenever she is ready to start. Stanford, Johns Hopkins, and Yale make similar offers. She receives interview requests from every major news outlet in the country. She becomes, overnight, a symbol of everything that is wrong with how medical innovation is recognized and everything that is possible when barriers are broken. But the transformation that matters most happens quietly, in places the cameras cannot see. It happens in the apartment in Roxbury, where Grace Okonkwo sits at the kitchen table her husband once used to teach their daughter about the architecture of the human heart. She holds a framed photograph of Chibuzo, taken on the day he received his medical degree, his face bright with the hope of a young man who believed the world would reward excellence regardless of its packaging. She speaks to the photograph as if he can hear her. You did it, Chibu. You saved that man. Our daughter made sure everyone knows. It happens in the ICU at Massachusetts General, where Benjamin Holloway wakes from sedation and learns that he is alive because of a teenage girl from Roxbury and her dead father's handwritten notes. He asks to meet her. When Amara comes to his bedside, he takes her hand and says nothing for a long time. Then he says, I spent my career in government trying to reform healthcare. I thought I understood the system. I had no idea how broken it really was. I'm going to do everything in my power to change that, and I am going to start by telling your father's story to everyone who will listen. It happens in conference rooms and operating theaters across the country, where surgeons who dismiss the possibility of learning from unconventional sources begin to reconsider. Where residents who have been overlooked because of their backgrounds find mentors willing to take chances. Where the walls that have separated different kinds of knowledge begin, slowly, to crack. And it happens inside Amara herself, in the quiet moments when the attention fades and she is left alone with her thoughts. She thinks about her father, teaching her to tie sutures on chicken breasts. She thinks about his voice explaining the philosophy of surgery at the kitchen table. She thinks about the morning she found him on the bathroom floor, his hand pressed against his chest, his eyes already beginning to dim. She thinks about the 19 minutes it took for the ambulance to arrive. Too long. Everything after that was too long. She does not know if she is healed from losing him. She does not know if healing is even possible. But she knows that his work will live on, that his name will be remembered, that the patients he never got the chance to save will be saved by surgeons using the techniques he developed. She knows that she has done something that matters. 6 months later, Amara stands at a podium in the grand ballroom of the Boston Marriott, accepting the American Medical Association's award for outstanding contribution to cardiac surgery. The room is filled with the most prestigious physicians in the country, people who would not have given her a second glance a year ago, people who now stand and applaud as she takes the stage. She speaks about her father. She speaks about the system that failed him. She speaks about the need for change, for openness, for recognition, that brilliance does not always come in expected packages. But then she says something that the audience does not expect. I am not here to tell you that persistence always wins. I am not here to say that if you just work hard enough, the world will eventually recognize your worth. That is a lie. My father worked hard. He was brilliant. He was dedicated, and the world never recognized him. He died alone, in our apartment, without the respect he deserved. The room is silent. What happened to Benjamin Holloway is not a triumph. It is a tragedy that almost happened. The only reason it did not happen is because I was willing to break rules, to trespass, to force my way into rooms where I was not welcome. That should not be necessary. People should not have to fight this hard just to be heard. The system should not make heroes out of those who survive it while forgetting all those who do not. Amara pauses. She looks at the faces in the audience. Doctors, administrators, policymakers, people with the power to change things. You are the system. Every person in this room is part of the infrastructure that decides who gets heard and who gets ignored. You are the ones who read applications and decide who gets fellowship spots. You are the ones who review papers and decide who gets published. You are the ones who sit on hiring committees and decide who gets opportunities. I am asking you to think about how you make those decisions. I am asking you to consider whether you are really evaluating candidates based on their merit, or whether you are evaluating them based on how much they look like what you expect merit to look like. I am asking you to imagine all the Dr. Okonkwo's who are out there right now, developing brilliant innovations that will never be recognized because they work at the wrong hospitals or have the wrong names or come from the wrong backgrounds. I am asking you to find them, listen to them, give them a chance. She steps back from the podium. The applause is slower to start this time, more uncertain, but it builds, and by the time she leaves the stage, the entire room is on its feet, not because they feel good, because they feel something else. Something that might be the beginning of change. After the ceremony, Amara slips away from the crowd of well-wishers and admirers. She finds a quiet corner near a window that looks out over the Boston skyline. The city glitters in the darkness. Millions of lights representing millions of lives, each one a story she will never know. Dr. Cross finds her there. He stands beside her, looking out at the same view. That was quite a speech. Amara nods. Did it make you uncomfortable? Cross considers the question. Yes. Good. They stand in silence for a moment. Then Cross speaks again. I have been practicing medicine for 37 years. I have saved more lives than I can count. And until I met you, I never questioned whether I was part of the problem. I just assumed that the system worked because I had succeeded within it. Amara does not respond. She waits. Your father should have been at that podium tonight. Cross continues. He should have received that award. He should have been published, recognized, celebrated. Instead, he died alone, and the only reason anyone knows his name is because you refuse to accept his invisibility. That is not a system that works. That is a system that fails everyone it does not favor. Amara turns to look at him. What are you going to do about it? Cross meets her eyes. Everything I can. It will not be enough, but it will be something. He pauses. And I need you to know that I am not doing it because I feel guilty. I am doing it because you showed me something I should have seen on my own a long time ago. You showed me that excellence does not always announce itself. Sometimes it stands quietly in the back of the room, holding a folder full of handwritten notes, waiting for someone to listen. Amara nods, slowly. My father used to say that the most important skill a surgeon can have is not steady hands or technical knowledge. It is the ability to see what is really in front of you, without the filters of expectation. Cross almost smiles. He was right. He was right about everything. Amara looks back out at the city. Somewhere out there, in hospitals and clinics and medical schools across the country, there are young people like she was a year ago. People with knowledge and passion and skill, waiting for someone to give them a chance. She cannot reach all of them. She cannot save everyone, but she can keep telling this story. She can keep pushing against the walls that try to contain people like her father. She can keep showing up in rooms where she is not expected and demanding to be heard. The system will not change overnight. It may not change in her lifetime, but every person who hears her story, every doctor who questions their assumptions, every institution that opens its doors a little wider, is a step forward. That is the legacy her father left her. Not just the surgical techniques in his handwritten journals, not just the knowledge she carries in her mind, but the belief that change is possible, that persistence matters, that the walls people build can be torn down by those who refuse to accept them. Amara Okonkwo is 17 years old. She has already changed the world once. She is just getting started. If you have ever been dismissed because of how you look or where you come from, this story is for you. If you have ever been told that your knowledge does not count because it did not come from the right institution, this story is for you. If you have ever stood in a room full of people who assumed you did not belong, waiting for someone to listen, this story is for you. The barriers we face are real. The systems that exclude us are powerful, but they are not permanent. Every time someone like Amara refuses to walk away, the walls get a little weaker. Every time someone like Dr. Cross admits they were wrong, the gates open a little wider. Every time a story like this gets told, the definition of who deserves to be heard expands a little further. Chibuzo Okonkwo spent his life trying to save people the world had given up on. His daughter spent her life making sure his work did not die with him. Both of them faced a system designed to ignore them. Both of them refused to be ignored. What would you do if you had knowledge that could save a life, but no one would listen? What would you do if the only way to be heard was to break the rules that said you did not belong? What would you do if standing up meant risking everything you had? Amara Okonkwo answered those questions with her actions. She walked into rooms she was not supposed to enter. She spoke truths that no one wanted to hear. She forced a system that had dismissed her father to finally see what he had accomplished. She did not do it because she was certain she would succeed. She did it because she knew that staying silent meant accepting a world where people like her father would always be invisible. She chose to fight instead. The outcome was not guaranteed. The victory was not inevitable. But the fight itself mattered. The willingness to stand up, to speak out, to refuse to be dismissed, those choices changed everything. Not because they were easy, because they were necessary. So ask yourself this: what knowledge are you holding that the world needs to hear? What barriers are stopping you from sharing it? And what would happen if you decided to push through anyway? The answer might surprise you. It might change everything. It might save a life. You will never know until you try.